bit of a change of voice for your GAP task this morning. And today we are looking at reproduction, and we're going to start with puberty. And with puberty, really, there are two things that you need to be able to know. You need to know about the changes. That's off my. The changes that take place during puberty. And you need to know about the hormones that control it. And you need to know these for both male puberty and female puberty. So a lot of these things will be sort of familiar, common sense. You'll talk about them in PSHE and other lessons, or have experienced them. But some of them are sort of less common or less obvious, and so you might not be aware of them. So I'm going to start actually with changes in puberty that happen to both men and women, both male and female. So I'm going to write those kind of across the middle. So in both, you get growth spurts, so tend to get much taller. In both, you get particularly growth of the genitalia. In females, that's just the external genitalia. In male, all of the genitalia are external. You get changes to the brain, including maturing of the brain. In both, you get hair growth, particularly in the pubic region and underarms. And those are your changes that happen in both. And then there are ones that are specific to males and specific to females. So specific to males, you get facial hair starting to grow. You get changes to the larynx, which is your voice box, and you get your voice breaking. The testes grow and start making sperm. And then you end up with body shape changes. Now you get body shape changes in females as well, but it's different body shape changes. So you particularly get wider shoulders and a broader chest in a male, and there are different body shape changes for a female. Then if we go into females, we get, so our body shape changes are mostly to breasts and hips getting larger. The ovaries start to cause eggs to mature, and that leads to menstruation starting. And those are changes for females. So some things that happen to everyone around puberty, and some things that are specific to the male and the female. And these differences are caused by the different hormones. Now the male hormone is testosterone, and it is quite nicely named. The beginning testosterone is made in the testes. And the female hormone is estrogen. It's not quite as nice in terms of how it's named, but it starts with an O and is made in the ovaries. So the next thing that you are expected to know about is the menstrual cycle. So I'm going to draw as sort of a timeline, but remember it is a cycle, so it's not a straight line, it goes round and around. As soon as you get to the end, you go back to the beginning again. So this is all kind of averages, so it does vary from woman to woman. We start with day 0 and we end on day 28. Day 0, actually should be day 0, it should be day 1. Day 1 to day 5-ish, 5 to 7. This is the period of menstruation. And then from day 5 to about day 14, you have the uterus lining built up. So it is getting ready to potentially host a developing baby. And then right at sort of the peak of the uterus lining being built up, so around day 14, you have an egg released. And this is called ovulation. And then between day 14 and day 28, the uterus lining is maintained. And basically that egg is being released, it's traveling down the fallopian tubes and waiting to see if there's a sperm cell that is going to fertilize it, in which case it will implant into the lining and there'll be a pregnancy. Or if it doesn't get fertilized and doesn't implant, then we go back to day 1 and we have menstruation again. And during menstruation, the uterus lining breaks down. And so roughly every 28 days, or roughly once a month, this happens. And it is controlled by a series of hormones. So the building up of the lining of the uterus is controlled and promoted by estrogen. Progesterone is the main hormone involved for maintaining the lining. And during this period of building up the lining of the uterus, you also have an egg maturing, which is controlled by a hormone called FSH, which stands for follicle stimulating hormone, and it causes the egg to mature. And then ovulation at day 14 is triggered by a different hormone, luteinizing hormone, or LH. So it causes the egg to finally be released. FSH gets it ready, LH releases it. And so these 4 hormones change in concentrations and make this cycle continue over and over again every month until the menopause. The last topic that we are going to cover today is controlling fertility, particularly how we avoid pregnancy happening if we don't want it. And there are a few different techniques that can be used for that, and a few ways of avoiding pregnancy, and they work in different ways. So they can either be hormonal, so there are some methods of contraception that work using hormones. There we go, now it's focusing. We have some that work as barriers, and we have some that are spermicidal. We have some that are surgical, and then there are a few others that don't really fit into these categories, so I'll talk about them later a little bit separately. So hormonal methods, they interrupt the menstrual cycle. They contain either a combination of estrogen and progesterone, or some contain just progesterone. and basically they stop there being an egg available to fertilize. So if there's no egg, there can be no pregnancy. So they stop FSH, so there's no egg maturing. They stop the uterus lining building up, so that there's no kind of ready place to receive a fertilized egg. And they also make the mucus around the cervix a bit thicker, which makes it hard for a sperm cell to get through and to get to an egg. So this is how it works. And with hormonal methods, there are a few different ones. There are pills that need to be taken every day. There are patches that need to be replaced sort of on every couple of week basis, and there are injections which are done about every 3 months. They all have advantages and disadvantages. And because these three all work in the same way, they do have some similarities in their advantages and disadvantages, in that they are all easy to use. Like this. And they are effective. Because these ones are longer lasting, they have that as an advantage as well. So patches and injections are both long lasting. Pills have to be taken every single day. The disadvantage to that is that you could forget to take a pill. With the patches, there is a risk that you'll forget to change a patch, but it is less so than the pill because you don't have to do it every day. But there are some disadvantages that cover all three of them because of how they work, and that is a risk of breast cancer, high blood pressure, and thrombosis. Thrombosis is when your blood forms a clot inside one of your blood vessels. So normally we only want blood to clot when we want like a cut to heal over, but thrombosis, it can happen inside a blood vessel and then it blocks off a blood vessel and can deprive part of our body of oxygen. So the risk is relatively low, but it does increase the risk of someone taking any of these methods compared to the average population. So our barrier methods, they work by stopping a sperm cell from meeting an egg cell. So unless a sperm cell meets an egg cell, you cannot have a baby made. And so they can completely stop it. Two main methods that we're going to look at are condoms and diaphragms. The main advantage of a condom is not only does it protect against pregnancy, but it also protects against STDs. In fact, it is the only one that does. It's really easy to use, no side effects. You don't need to see a doctor, so all of these things would need to be prescribed by a doctor. The injection sometimes will need to be given by a doctor. But with a condom, you can just get them from the shop. And the diaphragms also have no side effects. So the diaphragm, what it does is it works similarly to a condom, but instead of going over the penis, it actually sits at the opening to the cervix, and it's a small, about sort of that big disc of rubber, and it sits over the opening of the cervix, so the sperm can't get up into the uterus to meet the egg. Both of them, they have the potential to be damaged, and if they are damaged, sperm can get through and they become not effective. So both can be damaged. And with the diaphragm, particularly the positioning is very, very important, and it needs to be placed by a doctor. So our spermicidal, these are chemicals that kill sperm. So if the sperm is dead, it can't fertilize an egg. And so all of those chemicals fit into one. They have one major disadvantage, which is that they are not very effective. If they are used by themselves. Quite often, they're quite easy to obtain. Quite often they are used in conjunction, so together with diaphragms or condoms. So a lot of condoms come lined with a spermicidal chemical, or the diaphragm can be used with the spermicide as well. So they can increase the effectiveness of our barrier methods. So by themselves, really not very effective, but they can improve effectiveness of barrier methods. And finally, we get on to our surgical methods. Now, surgical methods vary depending on whether they're taking place in the male or the female. So either the tube connecting testes to penis is cut. So you can't get the sperm from the testes to the penis. A man can still get an erection, can still ejaculate, but there will be no sperm in it. And so if there's no sperm in it, you can't get a woman pregnant. Or if it's happening in a woman, the fallopian tubes are cut and tied. And so the developing egg can't get from the ovaries into the uterus, so a sperm can't get to them, and she can't get pregnant. This one is called a vasectomy. And this one is called tubal ligation or tube tying, but they can also be known as male sterilization and female sterilization. Now, there is something about this that is both an advantage and a disadvantage depending on how you look at it. These are both permanent. So that can be a great thing if you decide that you never want children, or you are done with children. That is your contraception sorted for life. However, it means it's a really big decision to have it done. You need to make sure that this is not something that you need to get back on. It then means that you don't have to worry about it. You can forget about it, and everything is sorted. Disadvantages, both of them are surgical procedures. Generally speaking, the male can be done under a local anaesthetic, so it's just a needle to numb the area, while for the female it is quite extensive internal surgery, and so usually a general anaesthetic is needed, so the woman is completely put to sleep. So I'm going to just talk about the last two methods that we have that don't really fit into any other categories. One is quite possibly the most obvious way of not getting pregnant, which is abstinence, which just means not having sex. If you're not having sex, you can't get pregnant. There is no way for an egg to meet a sperm cell, so it just can't happen. So it's 100% effective if practiced completely. Some people use a form of abstinence where they only avoid sex during the period where a female is fertile. That is much less effective, particularly in people who don't have a regular cycle, or people who are quite young where their cycle hasn't kind of gotten into a regular rhythm yet. So if you only abstain during the fertile period, it is much less effective. It will also mean if you are completely abstaining, you won't get an STD, and it is appropriate for people who, for religious reasons, don't agree with any of these other methods. So there are some religions, like Catholicism, that don't agree with this, but abstinence they're absolutely fine with. And then finally, the last method is called an intrauterine device, or an IUD. And so this is a small device that sits inside the uterus, and it contains either copper or hormones that prevent pregnancy, and basically they stop a fertilized egg being able to implant. They are very effective. They are long term. You're talking about 5 to 10 years for these that they can stay in. However, they have to be inserted by a doctor. Because it is going completely inside a woman's body, there is a risk of infection or complications. So some people get particularly painful, heavy periods that sometimes don't stop. And the process itself can be quite uncomfortable. Okay, and that is it on reproduction. I hope this video was okay. I know I'm no Dr. Hagen. If you have any questions, let me know. Bye.